I want to bring in another guest right now, Dr. Sujan Goju, a physician who worked there in Uvalde. Thank you so much, doctor, for being with us. We appreciate it. I just kind of want to know where you are and what you're doing in this moment. You're there in the town where this happened. What have the last few hours of your life been like?
Well, I'm not in Uvalde, Texas, but, I worked there about 3 to 4 years ago, when I was a medical resident. I was there for a month, and, I got to meet many wonderful physicians. I got to know people and the members of the community, people at that local hospital. And I can just say it's just such a close-knit community. The people that I worked with there, the physicians, I can't even imagine what they're going through. But it's just devastating to see this happen in such a small, close-knit, wonderful community.
Not familiar again with this town, or perhaps even this part of Texas, about 85 miles west of San Antonio. Talk a little bit more about the kind of community it is a little bit, and what folks do there and who they are there, just to kind of paint a more human picture other than what we know this town to be tonight, which sadly is a crime scene.
Yeah, it's a very small, close-knit community. There's, a lot of small businesses that are there. The medical sector, is very a big sector. Obviously down there is about 15,000, people that live there, and it's really kind of a blue-collar town. It's one of the best locations, to go gliding. If people love to go gliding down there. But it's just, people know each other, by name. It's 15,000 people, so everyone knows each other. And if you're not from the area, they know you're not from the area. Because when I rotated there as a medical resident, they're like, you're not from Uvalde. But they really treat, everyone so wonderfully. And so just to see something like this, when I saw it happen, it was just truly devastating, because I could never imagine something like this happening in that community with just the people I've met over that past month.
Wow. And you speak so warmly about the town, and we appreciate that. We want people to know there's a whole lot of humanity behind the carnage that we saw unfold there today. As a medical professional, can you also speak a little bit to what the local hospital in that town is going through right now, and what families and those wounded, what they may need in the hours and days ahead?
Yeah, when I was in that hospital, when I was a medical resident, it's a very small hospital. I can't imagine being able to handle the trauma that's probably coming in, because there was apparently the rumor was that there was about 30 people that were shot. So about 30 people had to go to that hospital, and I can't imagine that they have a on-call trauma surgeon there. I know they have general surgeons there and so forth, and they have plenty of family physicians, internists, and so forth. But no hospital system is prepared for 30 bodies coming in at once into that emergency room, combined with the fact that they probably already have people that are sick. And so I can't imagine what hospital personnel are dealing with there. But I know that community, I know some of the physicians there, they're going to open arms and help as many of the victims that are there. And unfortunately, San Antonio is close by, and so if any of them need to be, if any of the victims that are severely ill, they can be flown over to San Antonio. But it's just I can't imagine what that hospital is going through.
And thank you for mentioning that, because that was my next question. You mentioned this is obviously a very small town of 15 to 20,000 people, so that something like this could easily overwhelm a small town's medical resources. But the next place that some of these victims may be able to go, from what you know of the area, maybe San Antonio. That would be the closest that some of the victims, that'd be the closest area they could get to if they need treatment beyond what the local hospital can offer.
Absolutely. I mean, usually, patients that are gunshot victims, you typically have to go to a level 1 trauma center where you have, a trauma surgeon, and you have all the resources that are there at your disposal. And so a lot of times, when these type of situations unfortunately do happen, you try to stabilize a patient to your best of your ability at the smaller hospital. I can probably imagine that the hospital in Uvalde is probably a level 4, level 5 trauma center, probably would be my guess. And so they just don't have the staffing to handle. No, I mean, to be honest, no hospital has the staffing to really handle 30 victims coming in. But I know particularly, that such a small hospital, such as the one in Uvalde, I know they can't handle that. But, you stabilize, you then get that patient shipped over to a level 1 trauma center in San Antonio, which would probably be, either the military hospital that they have down there or UT Health Science Center, and you go from there and you hope for the best.
And I know you obviously you spent a good amount of time there in the town. Do you have any friends or colleagues in that area that you've talked to tonight, just to text or call and say, are you okay? What's going on? How can I help? What has been your communication, if any, with folks there in the town these last few hours?
Yeah, absolutely. One of my, physicians and mentors, when I was training as a second-year family medicine resident, he was grateful enough to take me to learn under his tutelage. I reached out to him and just wanted to just first off send my condolences, because I know he's very passionate about his community. And, the second thing, I just wanted to be there for offering resources to help if needed. And he was just thankful.
I'm sure they deeply appreciate that. Doctor, thanks so much for giving us a few minutes here on Newsy. We appreciate it, and please come back if you feel like the public needs to know what we all can do to help out, whatever the needs may be, as that community gets through this. Appreciate it.